in this particular article, what they're talking about is, how many of you have ever heard of MN choices? MN choices is the process by which eligibility for any of those waivers or PCA services, you know, all of the things Amy just made reference to, it starts with a MN choices assessment if people are covered on medical assistance. So, and all of it is guided by county case management primarily. And that can be a public health nurse going into homes. It can be support planning contractors. I mean, this is so multi-layered. You know, as you're looking at me, you're kind of, you know, I see some glazed over looks, and that's totally appropriate when you're not working with this day in and day out. And I think that, you know, Amy would concur. We've been after this, you know, we've been working with Medicaid funding in terms of long-term services and supports now for, you know, 30 years. And we learn something new every day. There's some nuance to it that we learn. And it's difficult to stay abreast of. But knowing who knows stuff is important. And that's where, you know, Amy knows some different things than I know. And we had a big, for those of you who maybe don't know, in Minnesota, we had one of those big Olmstead lawsuits in Minnesota that has resulted in kind of reprioritizing things. And so a lot of this lecture today is really about, this is a big commercial for the Disability Policy and Services class, because we take a deep dive in the class on a lot of these things. So this is your overview. But a number of you are going to the AUCD conference. And this handout that I gave you, actually AUCD produced it. And they have all of the different areas that each one of those areas we're concerned about all the time. Community living, Social Security, Medicaid, some sort of health care. There's, what else do we have on there? Education. There's always something either to be enhanced, amended, gotten rid of. We use the term sunset. Sometimes we've just outlived, you know, we've advanced to a point where that's not really a relevant practice anymore. And we're kind of on the cusp of that with day training and habilitation services and these sheltered work sites, you know, that at one point they were fantastic because nothing existed in the community for people when they were coming out of institutional environments. But now they're almost a little mini work institution, you know, so they've become kind of an archaic model through nobody's fault, but we have to create some new opportunities for people so that we can move those resources into more desirable outcomes that people want. And Rebecca's, I think, later this spring, aren't you? You're going to be doing a seminar in LEND on sheltered work, and yeah. So because that is an area where we really need to create something that meets some of the needs that a sheltered work or day training and habilitation environment meets now, but shifting it to better long-term lifespan outcomes. So that's kind of where we're at on that. Oh, here we are. Too many gadgets here. So how many of you when you think about policy, you just immediately go to elected officials? You know, that public policy happens at the Capitol or in Washington, D.C. Is that great? Okay, because oftentimes when people are thinking about advocacy or we start talking about public policy, you know, immediately they're just thinking, oh, that's what people run for office to do. And that's really the tip of the iceberg. is that is a sophisticated level of public policy, but there's so much that the rest of us can do. And I will say this again and again, just as Amy says, follow the money. That's kind of a mantra with figuring out all of the different systems. You are all advocates. The advocacy role does not belong to any particular discipline. Some of you may be in public health and public policy where those expectations for advocacy are high, but you all have a role. Kim just mentioned about the TEFRA fees. That's a way that families can pay into medical assistance. And they oftentimes have private insurance, so they have two different options to get their child's needs met. But that system isn't particularly equitable. And so we're always working. That's one of those efforts to enhance something or amend something. We don't want to get rid of it because it's met a lot of needs for people, but that private insurance won't meet. But anyway, so this is just a little pyramid, and you'll see this again this spring. We're going to talk about more specific civic engagement activities that all of you are going to be a part of. And then we're going to actually have LEND Fellow Day at the Capitol. And but I wanted you to start thinking about the issues that might resonate with some of the work or some of the coursework that you're doing or your family circumstances, because we're going to be asking each of you to hone in on one thing. Sometimes it's a scope of practice. And sometimes it's for the folks that are going to the AUCD conference here in November. AUCD is going to hand you a list and say, now you have appointments with all of our congressional leaders, talk to them about this. So you're going to get a little menu of conversation to have with policymakers, because part of that conference participation is engaging directly with the things that our elected representatives in Minnesota can do something about and can influence. Now, sometimes what's tricky sometimes with Medicaid is there's certain things that our federal congressional representatives can influence, and there's other things that our state representatives can influence. So, those are the things that we're going to wade through. You may propose something that you want to talk to a state representative about, and we may say, you're really going to have to go to Senator Klobuchar, on that one. And those are, that's just how learning about who gets to make what decisions, as Amy was referencing, in terms of the share that states and the federal government, the stakes that they have in relationship to allocating Medicaid. And the same is true with education. We have our stuff. There's always a controversy at the state level around special education, because Minnesota goes above the federal expectations. And so when they're looking at budget cuts, they're going, hey, why don't we just stick with the federal standards? It would cost us less, and that's, but, the nice thing about what Minnesota has done is, we really value education in this state. And so families and teachers and other professionals, they have had a lot of collaboration around expanding and enhancing things. So our state tax dollars go to pay for that. But it's not, things aren't always forever. So you have to keep a pulse on these things if they're meaningful for either your profession or else your personal lives. So these are the kinds of things that, in thinking about this spectrum, strengthening, you are all right here just because you're a LEND Fellow, that you are strengthening your individual knowledge and skills about policy. It counts. Today counts in that particular area. And then promoting community education. That sounds like, oh gosh, I got to do presentations and no, it means you talk to your neighbors, and it can matter. How many of you, Patty Carroll, when she was here talking last week, she had a lot of stories about different people's lives. Well, those are opportunities to engage people in policy-related conversations. And we have a lot of those. I live in St. Paul, and we have what is called trash war going on. And it's all about the St. Paul hauler, that the city of St. Paul made some decisions and ignored the preferences of residents. And so, they actually have T-shirts that say, they look like Star Wars, but it's kind of their logo, but it says Trash Wars in there. Anyway, it's gotten, it was just somebody kind of trying to lighten things a little bit. But that's community education. There's a lot of community education happening around that. And educating providers, that I feel like as a family who uses medical assistance and Medicaid services on behalf of my niece, that there's a lot of times that I'm telling a case manager, oh no, I think we could, I am aware that others have paid for this service. Oh really? I just haven't encountered, So, that's a very small scale opportunity to educate providers. But Hamdi was just telling me that she's going to be presenting at the autism conference. And there's a number of, individual practitioners that are that come to those conferences, and they're encountering a lot of people, but they need to expand their knowledge. Rebecca. And that's not the only conference either. So it's, but that's the one probably that we're most connected to, as a community partner, which leads right into fostering coalitions and networks. The Autism Society is a partner to the LEND Fellowship. We're kind of a coalition. And yet there's other groups that also are impacted by the same things. Proof Alliance. Remember our panel of people from different organizations? That was just a small sampling of coalitions and providers. The Minneapolis Schools is working with Minnesota Family Voices, and that formed out of, LEND Fellows made that happen. They said, oh, we learned about this, and then they were working in the Minneapolis Schools, and they made that connection. And they both found something that they had great strength in. And now it's just beautiful things are happening, right, Miriam? That's what I heard, actually. That is a direct quote that I heard from some of the participants in that training that you did. And then it comes down to changing organizational practices. This is the stuff that can happen at the state level. You don't have to go to the legislature for everything. Like TEFRA fees, the way we usually have to go to the legislature or Congress when we want more money, or we want something to be appropriated, or we want money to shift somewhere. But when the money is there, and this is MNChoices, that is an organizational practice that needs some changes. And so that's where it is stressful. It's an arduous process. It's necessary. A process is necessary. Does it have to be 3 and 4 hours long? Probably not. But that's a change in organizational practice. This series of articles that are emerging, and basically that top point is really kind of the sum total of all this. Everything that happens here culminates oftentimes in influencing a change of law. And that's what happened with the Americans with Disabilities Act, is that before that act passed, it passed, there was a group of strong advocates all of whom had disabilities, that went to every single state, all 50 states, and maybe territories, I don't know for sure. But they spent easily 2 years talking about that and what it could include and what it would mean for people. And that by the time that it actually was introduced as legislation, lots of people were already on board. But it was a lot of groundwork leading up to that. It wasn't just, let's write this and then ask people to stamp it. You know, there was a lot of coalitions that formed. So the things I want you to think about, you know, as we go into the spring, particularly, for those of you going to the AUCD conference, you're going to have to think about this stuff faster. But you're actually stepping into a coalition of people. I keep looking at you, Adam. Who else is going to the AUCD? Alyssa. Yeah, and this is a summary that they put out already, because there'll be more detail at the conference about that, and then the talking points will be rehearsed for our policymakers. So that's AUCD is a coalition, the Association of University Centers on Disabilities, and they determine priorities together. So is this all making sense? Can anybody think of an example of a coalition that you're already connected to? I'd love to hear some sharing of, you know, who you're hanging out with and what if you're trying to accomplish something. Policy is just the stage we get to play on, you know, but it doesn't fix everything, but it at least gives us a place to talk. We have a colleague right now that's doing some work. Well, you know McDonald, he's here. McDonald's in Kenya right now, working on some employment opportunities with another fellow that came here earlier from Kenya that AUCD hosted. And now McDonald is over there, but you know, they're just at the point of just trying to create a platform to even have a conversation. And so they're not at the stage of really trying to improve or enhance anything. They're just trying to get a few bucks, you know, designated for disability supports for people in terms of attaining gainful employment. So, yeah, so, you know, it just policy and legislation does not make everything better, but it greatly increases the opportunity to improve things. But that happens through all of this work that you and I do together. So, okay, so you will hear more about that. How this all happens, it's civic engagement, understanding the problems or challenges. You have an example of a problem in this article. You know, what's happening with min choices. But the answer isn't necessarily just to get rid of it, because we still need some accountability for the taxpayer dollars that go into the services we use. And a lot of that can be encouraged by telling stories and bringing forth different ideas, and then our partnerships and collaborations. So the first thing that I want all of you to do in this, how many of you know who all your representatives are? All your elected officials? Okay, this is the start of civic engagement. Okay, the other thing I'm going to say is, you know, it's not by chance that we're having this conversation today. Next Tuesday is election day. And I hope that all of, what? I think most places have city council people, or nobody? Yeah? Is that, okay. Anyway, there's usually something to vote for on the first Tuesday of the month. There's something, a school board member or a county commissioner or something, you know, in most places. So anyway, just know what that is. But if you, this is a link that you can go to, It's the Poll Finder Secretary of State, and this is a hyperlink, so when we get this posted on the Moodle, you can go right in there and just cut and paste or click right on it, hopefully. And all you do is put your zip code in. And for those of you who don't, some of you have come from out of state to go to school, that's fine. You're living somewhere. So put that zip code in and you can vote. And we have same-day voter registration in Minnesota, which is kind of unique. And again, that's a conversation oftentimes in the legislature about should we be doing that. But anyway, it's really important. And during especially pay attention to who are your state senators and your representatives, okay? Because when we do Len Fellow Day at the Capitol, we're going to have you make appointments with all of them for that morning, okay? And there's more to come on that. But you need to know who those people are right now, and because we may help you set up some of those appointments, but we need to know who you are. And there's some of you that probably live in the same district, so we want to strategically put that together for that day. So these are just some other networks. I already talked about AUCD. Go to Google, find out each one of these organizations, and this is not an exhaustive list, but this is a good start. And each of those organizations has a legislative agenda for 2020. Some may not be posted yet, but they're in the process of gearing up right now for the things that they're going to pay attention to. It may be TEFRA fees. It may be eligibility requirements for medical assistance. It may be paying direct support professionals more fair wages and enhancing their benefits and training. There's a whole host of things. And we're going to ask you, we want you to align with something that concerns you on either their legislative agenda so be thinking about these things right now. Because once the legislature resumes in Minnesota, it's kind of pedal to the metal, okay, in terms of being prepared. So now is your preparation time. It's your individual knowledge. You're fostering that in your spectrum of advocacy. So, and telling a story, we'll do an exercise with this leading up to our day at the Capitol, but it's, I want you to see what some components of that are right now so that you can really make a good story. But a good story, some key components of that are keep it brief and focused. Oftentimes, your conversation with an elected representative will not exceed 15 minutes. And if there are 4 of you, you may have to have something written up that can be left behind with their staff members. But the story is so important because you saw Amy just flipping through all of the data, and the data matters. The data matters, but that isn't what people remember. People remember the story, and then they want the data. They want to know how the story is substantiated. And we were talking in our group about vaccines, that sometimes, you can't put everything on just one story. Where are the trends? Where are the allocations of resources actually going? And policymakers want that data eventually, but they want it because they were tipped off by a story. And here's what I always do as a little bonus. I always put a picture of who she is, and if we invest in some vocational training and some other things, our desire as a family, we want to turn her into a taxpayer. So I want policymakers to understand that an investment over here potentially will come full circle. And that's the language of policymakers and money, the following the money stuff. So that's, and I get more, I try to update. This is shopping at Value Village, which raises money for the ARC. And so, look at, the money just keeps changing hands and flowing around. But I really want policymakers to understand that we are doing our part. We're not just asking you to give us more and more and more and more. We want to be good stewards of the resources that are entrusted to us. And that's a really important message, that, not just to complain and ask for more, but to also convey that you're a good citizen and you want to contribute to a better community. So this is another example. Amy wrote this story, and this is about the direct support professionals. So this same thing is, those two things are connected to each other. Here's somebody who's impacted, and here's somebody who wants to do the work, but can't commit to it because they're not making a livable wage. But they want to keep doing it, and they want to, so they talk about these things. Same thing. This is what I do as a direct support professional. And I'm doing some stuff that, that people at McDonald's are getting paid more, and their expectations are far less. And, and here are some challenges. These are the financial challenges that someone has. And we have a whole film about this. Have any of you seen our Invaluable film? It's a new film that we made. It debuted last summer, and basically we were having some screenings all around the community, and it's all about the direct support professional workforce. So we'll do, I don't know that we can take a whole seminar to do it, but we'll do a couple of special screenings if any of you want to see it. It's a little bit, it's over an hour long, and but it really gives you some good insight as to who's doing this work and who wants to and how important they are. And then again, the ask. And Amy took 2 paragraphs, which, you got to tell your story. And so, this is a big ask, because look at all these people, the Department of Human Services, Education and Labor, both parties have to be at the table to improve the situation. And it's been really hard to get them to talk to each other and to foster a spirit of cooperation across those two entities. That's what we want our policymakers to do, like make them do it. Make them sit down together. And so that's one. And these are LEND Fellows from a previous year that spent time over at the Capitol. We used to just make this an optional activity for people, and this year we actually built it into the calendar, and we're going to create our own special day, and some people from ARC are going to help us out with some priorities, and they'll be about, probably a month into the session, and so we'll have a good idea what the pulse of things are at that point. So, and just important things to come. Oh, I'm sorry, it's 3 minutes after. Sorry. Okay. Disability policy class, if you haven't registered for it, you should right away. This is when it starts and how long it goes. I don't have a location yet. I think it will be in Falwell Hall. That's what I'm lobbying for. And then our LEND Fellows Day at the Capitol is March 5th. So some of this stuff is just groundwork for those kind of things. And for those of you taking the policy class for credit, some of this is part of an assignment that's in the policy class. So.